Exosome treatment for fibromyalgia. Fibromyalgia is a chronic condition characterized by whispered musculoskeletal pain, fatigue, and tenderness in localized areas, and has seen innovative treatment approaches. One of them is exosome treatment. Exosomes are tiny extracellular vesicles that facilitate cell-to-cell communication and carrying proteins, liquids, and genetic material. Derived from mesenchymal stem cells, MSCs, they have been promised in regenerative medicine, including the treatment of fibromyalgia. Exosome treatment for fibromyalgia includes injecting exosomes, tiny particles derived from stem cells, into affected areas. These exosomes modulate inflammation, promote tissue repair, and regulate immune responses, aiming to alleviate pain, improve function, and enhance overall well-being in fibromyalgia patients.